Welcome to forpay.org. Thank you for joining this channel. Forpay.org stands for Foremost Organization Reimbursement Adjusted Yields. This organization will assist you in setting up a deductible health insurance along with funding the health savings accounts. The goal is you pay into it and it pays you back 10 times. It has a triple tax benefit. A lot of you folks, they have no idea how to empower a consumer. The goal of the forpay.org is to empower the consumer, which will lead to consumer-driven healthcare, folks. Consumer-driven healthcare. That's the goal. This is Consumers Dr. Bengala. Why are you doing all this? A lot of people ask me why. I'm passionate. Healthcare, we are going in the wrong direction. We have spent $3.8 trillion in 2020. We rank 38th in the world. It's simply not acceptable, folks. How can we make America the number one in healthcare? I'll tell you how. Take away the middlemen. Middlemen is siphoning. You name it, folks. You're talking about insurers, providers, acting like middlemen. They are siphoning the funds in the middle. I want consumers to get that savings, not to the middlemen. The forpay.org goal is to set up a health savings accounts which consumers control 100%. And this nonprofit organization goal is to set up a deductible health insurance plan. Health insurance plan based on your capability. You can have a deductible up to $1,000, $500, $1,500, $3,000, $5,000, $10,000, basing on your capacity. Then you lower your premium, lower your health insurance premium. If you're an individual or a family, it doesn't matter. Then put money aside into the health savings accounts. Folks, $10 a day for an individual, $20 for the family. Is that too much to ask for everybody? $10 a day comes to $300 a month, $3,600 a year. And $20 for the family comes to $600 a month and $7,200 a year. In 10 years, folks, I can tell you right now, in 10 years, that's $32,000 will be $40,000 to $50,000, and $72,000 will be $100,000 in 10 years. Just 10 years. Can you imagine if you're young in 30s and start your health savings account? That's the way to go for the healthcare. I believe we as a country, healthcare is being, consumers have been ignored, and insurers are in the driver's seat. I want consumers to be in the driver's seat, and only consumers can lower the cost of the healthcare. No one else. I can vouch you on that. People talk about, British system, you talk about Canadian system, folks. Americans will never go for it. Americans will never go for that so-called two-tier system where people who have it and people who have one system, people who have not has one system. Americans will never accept that. So forpay.org goal is to set up health savings accounts, so-called rainy day fund for your future health care, for you and your family. There is an application. I put an application in the source column, and you can fill up the application. You can also get a health insurance from any carrier with a deductible policy. Then we'll qualify for the HSA, so-called Rainy Day Fund for Healthcare. We will assist you. We will assist individual, families, companies. Yes, I've been in the healthcare business for too long. I know the healthcare business. I've been in this so-called maintenance organization. Folks, middlemen, so-called bureaucrats, are siphoning your funds. Yes, I want to change the direction of the healthcare as we see it, folks. As we see it, yes, it's possible. We can do it. Let's do it. Let's work towards setting up a health savings accounts, so-called rainy day healthcare fund for you and your family. And if everybody does it, America will be number one in healthcare delivery, like any other sector, folks. Join me towards that goal. That's my lifetime passion, folks. Join me in that endeavor. Thank you for listening, and we will see you in the next episode. Goodbye and God bless.